I'm Dr. Maria Anton. I'm an endocrinologist at the Pritikin Longevity Center. I work with patients who are struggling with obesity. Obesity is linked to a wide variety of health complications, including diabetes, heart disease, cholesterol issues, blood pressure issues, along with certain types of cancer. Patients that are struggling with obesity and these chronic conditions that are likely associated with it do have a higher chance of mortality and a lower lifespan. So it is extremely important for us to address any weight loss that the patient is trying to achieve in order for them to hopefully either avoid those long-term complications or to help improve those. Medications like semaglutide, which is also known as Ozempic or Wegovy, have come out recently and become extremely popular because they do help patients rapidly achieve weight loss. Many patients are able to improve their overall outcomes, decrease risk for heart disease, they're improving their blood pressure, they're improving their cholesterol numbers, their blood sugar, just with the weight loss that they're able to achieve with these medications. There are some risks that are associated with these medications. With any rapid weight loss, there is not only fat loss, but also lean body mass loss, which is our muscle mass. In those patients that are taking semaglutide, they found that up to 35% of the weight lost was actually the lean body mass. Lower lean body mass is associated with a shorter lifespan and an increased risk for all-cause mortality. It's also associated with the way that our hormones are working in the body, especially in terms of insulin resistance. When we lose lean body mass, we do lose overall strength, usually as well, which can increase the risk for falls and fractures because the bone density can also be affected. So we want to maximize patients' results in terms of achieving their weight loss goals while preserving as much of that lean body mass as possible. The best ways that we can do that are primarily through diet and exercise, which is something that we really strive to help patients with when they arrive here at Pritikin. We give the guests an opportunity to speak to exercise physiologists where they can develop their own individualized exercise program to really optimize their weight loss while still maintaining that lean body mass and also helping to build new muscle mass. They are able to go home with a really effective exercise plan that can help them achieve their goals. Similarly, they're able to speak to nutritionists and really develop a diet plan that works for their particular needs, whether they have a history of diabetes or insulin resistance or not. They're able to speak to somebody that's going to really optimize the amount of protein that they're getting in their diet day to day in order to optimize their results while taking these medications. Patients are able to sit down with a physician as soon as they arrive to Pritikin. They will have their vital signs taken. They will also have a set of blood work done. They're able to speak about their own individual health goals and together come up with a plan about how to achieve that. And if a patient is coming in on one of these medications or is interested in starting on one of these weight loss tools, then we will likely recommend a body composition scan. These tests really help us to better understand where a patient is in terms of their body composition. That means lean body mass versus the fat content of the body. Having these tests as a baseline is very important, and we can do those tests once a year in order to evaluate for any loss of lean body mass. It's crucial for patients to understand that while these medications are revolutionary tools that can really accelerate weight loss and help them achieve their goals, the foundation is still the same. They still need to make the lifestyle changes. They have to fix that relationship with food. They still need to really work on consistency with the exercise. While patients are at Pritikin, they have the opportunity to really focus on themselves, to really establish new habits that will help them to achieve their long-term goals. If you have weight loss goals, we invite you to come visit Pritikin, where we can help you establish the best nutritional and exercise program to optimize your results.
Do you have any questions before we get